Good morning, good afternoon, good evening, regardless of where you are in the world. I want to thank you all for just tuning in to this special edition, this session for Women's History Month, where we're going to be talking about health from some amazing healthcare practitioners, one in South Africa, as well as one in the United States. And this is near and dear to my heart as most people know that many years ago, I talked about, my mom passing of cancer. And there were so many things in which we found out along the way, but we wish that we had known much sooner. And when you're talking about women's health, which is critically important because we birthed the world, it's important to make sure that we understand our numbers, but we also want to make sure that we're creating space, safe space, where we can talk about the things that we need to know and going into the doctor, the things and the information that we can share with each other. And although this is focused on women and girls today and celebrating this month, this is also good information for men as well. One, in being advocates for their loved ones, but also taking some of this information so it can be utilized for themselves so that they can advocate for their own health. So welcome to our masterclass, Scale Up Your Skills, where we're really going to dive deep into this medical conversation, but it's also a heartfelt conversation. It's going to be led by none other than one of our ambassadors, Effie. Effie, she came into the organization last year by storm, and I like to make sure that we're always showcasing our best and brightest whenever we're having any of our conversations, because nothing stays with us. We have to make sure that we're incorporating our youth so that they can be a part of the conversation and leading this. And before I turn it over to Effie, a couple other things that I want to just highlight. When we're talking about advocating for yourself and knowing your numbers, just some interesting statistics, specifically within the United States. Women gained comprehensive rights to healthcare in 1990. That was the same year that I started university. That was not that long ago. When you look at funding and research for women, it is disproportionately favored more towards men versus women. And throughout the continent of Africa, uh, there's been strides that has been made, but the quality of care and having access to it really was not available until the late 1990s, early 2000s. So we talk about can go. What are those things that I need to know for my body as I'm changing and evolving? Those things are always going to be important, but I want to make sure that we land on, we're still in our infancy and having open conversations and dialogue about health. And we're going to get into that today. So welcome to this session. And I'm going to turn it over to Effie, and she's going to guide our two fantastic medical practitioners into having conversations that I wish I'd had when I was younger. Effie, over to you.
Thank you so much, speakers, Dr. Elizabeth and Nurse Tembisile. Nurse Tembisile is the founder and CEO of Nikiwe Health and OH Enterprise. She's a nurse entrepreneur and an occupational health nurse consultant. Her journey began in a nursing college and ended in the University of Johannesburg for postgraduate qualifications. Nurse Nikiwe is a seasoned and dedicated healthcare professional who brings over 2 decades of experience in her role as a professional nurse with passion for patient care, commitment to excellence, and health education. Dr. Elizabeth Nelson is a board-certified internal medicine physician serving the greater Berkeley community since 2009. She left her private practice in November of 2024 and joined a group called Access Health West Virginia, where she brought over 1,800 patients for internal medicine care. She completed her medical education at Howard University and completed her internal medicine residency at Georgetown University Hospital. Initially a hospitalist, she shifted to an office-based practice at Southern West Virginia Clinic in 2019 to foster deeper patient relationships. Dr. Nelson's area of expertise include women's health, diabetes, weight management, and hormonal health. She emphasizes compassionate care that incorporates both holistic and traditional medicine. She is a proud member of Delta Sigma Theta sorority.
Start off by saying greetings from wild and wonderful West Virginia. And I want to thank Tina because she's been a real blessing to me. Tina Taylor, who of course is an entrepreneur, an activist, and a philanthropist. She inspires me. I think anytime that we are down in our lives for whatever reason, and there are many opportunities for that, just if you live long enough, we often ask God to help us. And sometimes the best thing to say is, how can I help others? And that's a question that I can see she asks often. And she often can add a lifeline, not just to the people she's helping, but to the people who are she's giving the opportunity to let help her. So I just wanted to start off by thanking her and being grateful for having her in my sphere.
Ndisile, do you want to add anything, or can I go into the introduction questions?
Oh, okay. I don't think there's anything that I need to add. I think all is well said. The only thing I can say is thank you for having me in this platform, and it is indeed an honor to be part of the Women's History Month. Thank you.
All right, fabulous. Okay, let's start with our introduction questions. What inspired both of you to go into the medical space? Let's start with Dr. Elizabeth.
What inspired me is kind of interesting, maybe an unusual story. But I used to watch General Hospital with my mother, as some people, as the older people say, the stories or the soap operas. And I watched this Black woman doctor named Angie, who's of course played by the Debbie Morgan. And I had never seen a Black woman doctor before. Of course, they get you into the storyline with the romance and Angie and Jesse and so forth. But what I loved is that God, I know, inspired me to want to help people, and that was one way of doing it. And being able to see an example of a woman that looked like me doing that, even if it was fictional, really did give me an opportunity to have a goal that and a seed that was planted in me by God. So that's what inspired me.
Just goes to show the power of representation within the media for young Black girls everywhere. Thank you so much. Nurse Thembisile, would you care to answer the question, please?
Oh, okay. I think with me, something that inspires me, it was like a natural thing. I used to see the nurses with those white dresses and the cape, and I just thought, ah, this is what I need to do. And out of that, as I was like continuing with my primary and my secondary high school education, I developed that passion for helping people, and nursing was my first choice, and I actually like pursued it, and that's how I arrived here.
Could you please give a brief insight into some of the challenges you may have faced and how you overcame that within your career?
So for me personally, it's been a bit of a challenge to often be thought of not as a physician, but as a nurse, which again, there's no issue there, except that the additional training and the fact that you walk into the room and being able to command respect, not just based on gender, sometimes it's based on race, but people will often defer to the male in the room, regardless of their color. And they make an assumption that you're not a physician. And it's interesting because, and this had come up in recent conversations we had preceding this talk, but I'm not in the habit of wearing a white coat, and I haven't worn one in some time. And so, at least in the States, a long white jacket implies that you're a physician. The shorter one, of course, that you're a medical student, and so having done that, I have to command respect in different ways or make it clear who I am in different ways. I have male counterparts that ask their patients or let their patients call them by their first name. So I don't do that. I don't lead with the fact that I'm a physician when I interact with people. But when I'm with patients, I kind of have to describe or insist on a boundary that happened because of what I've experienced in the past.
Okay, on my side, I would say as a Black woman in my country, it's the challenges of everything that is higher ranks and stuff will always be considered to be for the males. And when you opening the business, there is challenges, including not limited to access to funding capital and self-funding to start up and maintaining work-life balance. Lack of mentorship is one of the challenges that we actually come across. So it is a struggle to really pursue, but we still go on, we still do it.
All right, Ms. Tambisile, I think that's a great introduction into your first specific question. As a nurse entrepreneur, how do you find the balance between being a healthcare practitioner, being an entrepreneur, and being a leader? What are some of the sacrifices you've had to make to establish yourself at such a level? And awards and, you know, the internal feeling as well. What came with such an achievement?
I think it is not easy, but I try, because when I'm at work, I put 110% to my patients. I give them all the attention. And when I'm home, and then I also have to be with the family. And it is so unfortunate that one of those people that the family relies on. Everything has to be decided by you, and everything has to be done by you. So I try, and I think with God just give you strength to do things. Then when you look back, you ask yourself, how do I manage every day to do this thing all by myself? Because everyone is relying on you. They all want answers from you. They want provision from you. And my patients, unfortunately, there's time when at 10 o'clock I will receive a call or a WhatsApp, sister, this is the problem. How can I solve it? Or I've got this. And I have to answer them, even if it's my space for the family. So unfortunately, there's no family time, there's no patient time. I just combine it together. Whoever needs help at that specific time, I just attend to them. And like I'm saying, it's God-given strength. I don't know how I do it, but I do.
Do
Thank you.
you generally feel as if you have to work harder than your male counterparts?
Yes, I think that is actually true. I have to do that, because if you don't prove yourself, then it will be that myth that, yeah, it's a woman. What do you expect? Why did you give her that opportunity or that a position? So you have to just go an extra mile. Whatever you're doing, you strive for excellence, so that no one can actually question whether you are capable of doing that or not. So definitely we have to actually, when I put it straight to myself, I just run an extra mile in everything that I do in order to balance whether either I'm a female that is actually capable of doing it, even if I'm in contest with a male, a colleague also.
All right. And Nurse Nikiwe, you're based in South Africa, so you know the statistics of sexual assault in the country. Notably, in 2024, it was recorded that 53,500 women reported being sexually assaulted. Um, how do you think the South African government or the healthcare system is failing to address the long-term consequences of sexual assault and sexual violence on women's health?
Oh, okay, with us in South Africa, it is definitely a big challenge of the GBV and the sexual assault. And as much as the government is saying they are making awareness, they are trying to make it a go away, it isn't, because some of the people that are actually doing that, they keep on doing it, and we are losing every woman every minute in South Africa through GBV. And with the sexual assault as well, I think the poverty is also contributing a lot, because some women will like to say no to some things because they need to be having a living. So if you say, okay, for example, I'll make an example. I have a husband and I've got a daughter, and I realize that my husband is actually sexually assaulting my daughter, but I would keep quiet because of I'm now belonging to this man. Everything I'm relying on this man. So such things that women are actually not empowered to be able to be independent and don't depend on somebody for a living actually is actually putting things worse for the women. And as for the government, I think the cases are not really taken seriously as they are saying, because they will say this has to stop, this has to stop. But when somebody is been taken to court or so, they just come out and that women didn't actually get any justice out of it. So I think whatever they're saying, it should be practical. That if you've done a sexual assault on a woman, it is a high treason as far as I'm concerned, because it's never gonna stop.
You mentioned financial instability and the fact that women feel as if there's no way out. From a nurse practitioner's point of view, what resources are available to women today in cases where they do feel stuck and they do feel as if there is no escape?
It's just a one-on-one, and you need to assess the situation and the challenges whatever individual is facing. So there are some groups or NGOs that help such women so that they can escape the environment that is toxic and that is endangering their lives, to go and stay there, which is funded by other companies. And it, like I'm saying, is a NGO, whoever contributes. But there are shelters also that are provided to such women. But on my side as a nurse, it's just a referral, because most patients will come and they will verbalize their frustrations, their challenges at home. So mine is to just look for such places and try and refer that patient so that they actually get a help that could move them out of that situation.
Okay, thank you. Dr. Elizabeth, I want to include you in this conversation. From a internal health perspective, what are the long-term impacts of women when they experience sexual assault? And why do you think such conversations are often overlooked when discussing women's health?
Well, I think in general, as human beings, we stray away from conversations that are uncomfortable. So I've been doing women's health for many years, but I incorporated it more, obviously, when I started seeing patients in my office in 2019, because of the intimacy of the types of conversations and being able to see people on a more regular basis for follow-up. Though I had some of those conversations with patients as a hospitalist as well. So interestingly enough, and I don't want to forget your question, but I had a patient that came last week to see me, and she has been repeatedly sexually assaulted by her spouse. And unfortunately, just as when women may not be taken seriously if it's their boyfriend or a lover or whomever the case may be, someone that they're already a friend of or an acquaintance with, I think that listening and validating and holding space for people goes a really long way. And I also think empowerment, as you know, was already discussed by Nikki, goes a long way. And unfortunately, financial freedom is probably, if not the number one or two reason for why women don't share their stories. And fear is up there too. I'm not sure in what order, and this is in my experience. So we almost have to simultaneously discuss women feeling empowered and being independent from the men with whom they're in a relationship. And that's obviously regardless of there being any domestic violence or sexual assault. And I'm not saying anything against women that choose not to work outside the home, but I am saying that even if you choose not to work outside the home, you must have a plan so that should this man hurt you physically, emotionally, or so forth, you have a way of establishing freedom, even if it's with a family member who is in the know and can help you. And I don't know that that really answers your question completely, but that was just an experience I recently had. And I just think as a practitioner, as a physician, listening, and not just to the words, but picking up on the cues that someone may have, and asking the question, because quite frankly, I think asking if someone is depressed, it's one of the things that they require of us here. And then you check the box and move on. But then I ask people about their social situations. With whom do you live? Are you in a relationship? How is that relationship? Do you feel safe? And that sort of thing. And really looking to make sure that they're not just answering the question because maybe based on fear or judgment, and holding space for them to be able to do that, honestly.
Your last point, it's not common for doctors who aren't aware to do that. So what training or resources do you feel like need to be available to healthcare practitioners to equip them for such situations? And that goes for you as well, Nurse Thembisile. What do you feel as if the medical system should put in place to educate not only the people, but the practitioners to better equip themselves for such situations?
Well, there's an incredible amount of training available. If you work in a healthcare setting, to me, there should be, and there is actually continuing medical education available for what to do in the event of sexual violence, assault, mental health concerns that may arise. I think that there are people that are in practices on their own that don't necessarily explore those opportunities to learn, and continuing medical education is important for physicians, nurses, nurse practitioners, everyone. And you have to hold yourself to the standard to be able to look at you can easily do CME, continuing medical education annually, and avoid the topics uh, that may seem uncomfortable to you or that you don't find interesting. But uh, I don't understand how that could not be interesting if you have a population of patients that could be suffering from some of those issues, such as domestic violence or sexual abuse. So I would say the answer to that is doing more education, making that a part of it. Just as in West Virginia, I'm sure you're aware, or in the States and elsewhere, there are lots of issues with regard to substance use disorder. So that is now required when you do your recertification, and I believe this should be as well.
And then Nurse Thembisile, what, in terms of South Africa, what do you think should be put in place to educate healthcare practitioners? Because we know it's such a big issue in South Africa, but unfortunately, not all nurses or doctors know how to tackle a patient adequately when they come to them with such a situation.
Okay, in South Africa, we have what we call a continuous skill development. So I think it should be enforced to all the nurses who are actually exposed or come across such patients, because we are given training. There is a platform where you will have to register, and even if it's a webinars that we attend, maybe in the evenings, such topics are actually we are giving training on it. So it's us nurses that needs to commit to attending that, and we develop our skills. Because yes, you can have the basic knowledge as to this situation, how do I handle it? But things change every day. So continuous development should be, we should actually try and pursue that. And as for the government, there is a knowledge hub, which is one of the platforms where we can do our trainings. There's a lot of courses, actually, even the one pertaining to the sexual assaults, even the kids when they're abused. So it's us nurses that need to have that drive to up our skills.
Correct me if I'm wrong, but Nurse Thembisile and Dr. Elizabeth, you made it sound as if it isn't mandated. So I know, Nurse Elizabeth, you said it's mandated in terms of a drug abuse point of view. Why do you feel as if it is such? Is it a thing of the awareness around the situation, or is it a thing of complacency?
Well, it's the very reason why these forums are happening and why we have Women's History Month. There isn't as much emphasis on care in general, globally even, but I can speak for the United States, on the things that don't affect the people, the things that affect the people who are in the minority. And that's unfortunate. And so that's why activism helps. And you know, the more that that happens and the more that we make things a part of the requirement for recertification, then I think people will become, even because of necessity, they'll have to do it in order to get their certification for nursing or being, you know, being a physician, for internal medicine doctor, which of course is, I'm an internal medicine doctor, I'm an adult doctor, but we all know that even pediatricians come across it because children, unfortunately, experience incest, domestic violence, sexual abuse. And that's, you know, that leads us, of course, into STD screening, which I can, you know, we can talk about more later. It leads us into pro-life versus, you know, those people who want women to be able to allow women to be able to continue to make their choice, and knowing that each circumstance is different. So that's the beginning, I think, of why opioids have affected people's pocketbook. It's affected money. So not until people think that there's some sort of a financial gain, and I'm not trying to be, I'm not trying to look at this in a negative way, but I feel like the areas that get the most attention ultimately are affected by if people think that there can be financial gain from it. So once we can show people that that is not the main concern, then perhaps it'll be more of an emphasis on that.
Yes, Nikiwe, in terms of resources available or things that, as a South African, a young woman in South Africa, what should I be looking out for? When should I be going to my appointments, specifically to a woman in South Africa? When should I go for my screenings? Do they cost me anything? Are they available everywhere? Are they only available for a certain group of people?
Sorry. Okay. With in South Africa, we are having the primary health clinics, which is free. And we also have the private clinics, which is at a cost, but not that much that people cannot afford. But those that cannot afford, they are having a free services at the local clinics or the primary health care settings. And they can actually, with the teenagers from 9 years to, I would actually encourage, or that's what I always preach, with the 9-year-olds to 45 women, they can go for their cervical screening to check for any HPV, or to go, if there isn't, to go, actually not to check, to go for the vaccination, because they can take it from 9 to 45 years old to prevent any cancers. And as well as the family planning, it is available as well as from 12 years old, and they don't need any consent. It's free from the primary health clinics. So women can actually utilize those places in order to plan for their lives, because we are having actually a huge challenge on teenage pregnancies. And if we can actually increase the awareness on them being going for the family planning to avoid those, because that actually causes a breach on their education, and some they will drop from school from their teenage pregnancies, which was going to be prevented if enough education is given to them at a right time. But if they are aware, they can just go to the clinics. It is free. They will be helped at any time.
Going to jump in. So I have a question, and then I also see that Karen has a question as well. So when we look at being an advocate for our own health and with our teenagers, what questions do we need to think about asking our doctors? Or, I always tell people you need to interview your doctors to determine if they're going to be your doctors, or any healthcare facility. But what are those things that you think that we need to ask to make sure and to validate if we're getting the proper care, and or if they will be able to provide?
So, of course, you and I have had conversations, and it is interesting because you do have to start with childhood, like you mentioned. So, childhood obesity, for example, is a huge issue. And there are so many habits we develop in our youth. But the interesting part is that you're seeing a pediatrician roughly, some people see pediatricians until they're about 18 or 19, roughly when you, in the States at least, roughly until you go to college. And then maybe when you're in college, you see someone in the student health center for just a, just a check mark physical exam. But when the first thing I would say to someone who's trying to be an advocate for their own healthcare is, do you know your own personal medical history? Now, that may seem odd because people would say, yeah, no, I've never had any major illnesses, no surgeries. And I actually have twins that are 19. I also have an almost 17-year-old. And my daughter forgot that she had surgery as a baby. And of course, she probably would. She was a baby. She was about 18 months. No, she was about 12 months when it was an inguinal hernia, nothing major. Nevertheless, there are things that we don't bring up to them again. Childhood illnesses, even like, unfortunately, we're getting measles back again, and we know there are issues with regard to immunizations happening because we're losing that herd immunity from people who were continually getting the immunizations, and now the options are open for people not to do it and so forth. So there's a resurgence of diseases that had previously been long gone for people who were had a patient traveling to Texas recently. And I had to check an MMR titer on her because I didn't feel comfortable. She's older. Of course, had measles when she was younger, but has long since likely had the immunity for it. So the first thing I would say is to discuss with your parents or your caregiver, whoever raised you, grandmama, whoever it may be, what childhood illnesses did I have? And that includes, the diseases for which we're immunized. What immunizations have I had and which have I not? Some children, and when I say children, when they become adults, they don't know if they've been vaccinated against HPV. And we can talk about that more later. They don't know their immunization record, which here in the United States is a matter of something that the health department has on file for you. So you don't have to go round up all of your doctors. It's well, not public record, but it's something that they keep all in one place. And your family history. So culturally, a lot of people just do not know what medical conditions even their parents have. Sometimes that's something that is not discussed with them because of shame or because depending on what the condition is. I have a sorority sister who didn't know that her father had HIV. And of course, that's not communicable. Well, that's communicable, but it's not genetic. But that's just an example of the secrets that we sometimes keep. Maybe someone had a lymphoma, or often I come across people who have arthritis, and they say, well, my mom had arthritis. And I say, well, what kind of arthritis do you know? And they don't. They don't know if it's rheumatoid arthritis,
Rheumatoid.
osteoarthritis.
Yeah.
Correct. And so obviously they all have different paths that you would take to treat each of them. But I don't want to overspeak. But family history and your own personal history is a good start to advocating for yourself when you start to see a physician. And the last thing I'll say is to ask the physician if you would be seeing, or the nurse practitioner, will I be seeing you solely, or will there be times that I would see someone else? And if that's the case, will you call and let me know before? Because if you've already taken the time to get to establish a rapport with this practitioner, it would be unfortunate, and it happens, where you're in a group. And when I was in my own private practice, it definitely would have been more financially solvent and beneficial for me to hire a PA, a physician assistant, a nurse practitioner, or even another doctor. But I was willing to see less patients and have them see me because it was me they came to see. And so I didn't want to make myself more profitable at the expense of not giving them the personal attention that they needed from seeing me.
Add on that the family history, because that's one thing that I actually come across when I'm doing on occupational health. You have to take the full history, family history, and the individual employee history. So in many a times when you ask, is there any member of your close immediate family that has got any heart diseases, or most of the time they don't know. And you find, is your parents still alive? Yes. Have you ever asked your parents if they have? No, I know my mother goes to the clinic, but I don't know what is going for. So I think that is actually critical for families to sit and discuss such things, not to make it a taboo for kids to know that my mother has got hypertension or my father died of diabetes, if they know, because that plays a big role for us when we are giving a health education, especially when it's that disease is running in the family, because you need to sensitize them on that, because people think, if I don't have hypertension now and I don't know if my parents had that cardiovascular diseases, they tend to relax. And in these cases, mostly now we are seeing people from 25 already hypertensive, and some had to start the treatment at that earlier stages of their life, and they don't know the history. And comes to measles, as Dr. has actually mentioned, when we're doing the audiograms and stuff, we need to find out if they have ever had any measles or any medical condition that can affect their hearing. But you find that they actually not even aware. So I'm not sure whether the parents don't sit down and talk about it, or they were not also, or they don't think it's important, one, and they don't know what is the long effect of that disease that happened at the childhood, from that baby or child to adulthood. What other long effect will it have? So I think for that, we need to sensitize families to discuss their family history, so that people will be on the light what to look for in their lives.
Effie, may I add one more thing? I'm so sorry. I wanted to add something that can be uncomfortable to ask with regard to family history, and that's reproductive history. So often women do not know if their mothers experience a pregnancy loss. And that's important for a few different reasons, because it can often be that they have had an undiagnosed or later perhaps diagnosed autoimmune disease, clotting disorder. And another thing would be, oddly enough, but I think it's pertinent because I've heard it enough times too. So sometimes people think the aunt or the uncle is a blood relative. And yeah, we have diabetes in my family. Well, no, you don't, because it's your auntie or your uncle, or this person was adopted and you didn't know it. Or unfortunately, some people don't know that they were. So these are just common things I've come across. Coronary artery disease, of course, as she mentioned, which as Nurse Nikki mentioned, because if you're 50 or younger, then you need to be screened earlier. Same thing for colon cancer. So just along those lines, having those conversations, like she mentioned, at an earlier age, and remembering to bring them up again so that and writing it down, maybe put it in your phone so that when you go to the doctor, you can bring those things up.
See, this is the reason why I think part of it, people don't have the conversations because nobody had the conversation with them. And so where do you even start? So I feel like we need to have a part two. And we're 10 minutes from this concluding, but I want to make sure that we get Karen. I know it goes by so fast. Karen, I know you've had your hand up, and then we'll turn it back over to you. And then we'll turn it back over to you, Effie.
So greetings, everyone. There's a lot of questions going in here, but I think I just want to start with this one. And now that you've talked about female reproductive systems, as like studies have shown, there's not really much known about that area. It's just as mysterious as outer space right now. But because like now girls are starting earlier and the symptoms have like been getting worse and pain just gradually increases depending on who the person is. So I would just like to know your views about young ladies, even because there are some that are even at the age of 14 or maybe 12, then they feel like their periods, their menstrual cycle is just so much to handle and it's too painful for them. And when they go to the hospital and like ask, can I get a hysterectomy at my age? Can I take it out because the pain is too much? And most of the times they are denied because they're like, what about your future children? What if you want to have children in the future? And it's always about what if you regret it and not how you're feeling now. So as professionals in that case, how would you take a view with that? Because again, the girl is sitting in pain currently. It's too much for her to handle, but she's been refused the right to take it out because they just care about who she could potentially give birth to, how she would be in the future, how many kids she's going to give birth to the future, and always telling her to wait longer instead of taking it out now. So I just like to know your views on that.
Well, so I do pelvic exams and once a week in my office. And so I come across quite a bit of what you're talking about. There are many alternatives to doing a hysterectomy. So I don't disagree with people doing that, but I do disagree with people not exploring what the alternatives are. For example, if you have, you may know, and we're talking about risk factors, Black women are at higher risk for uterine fibroids, which are when you have either a growth of endometrial tissue inside of the uterus or on the outside. Sometimes it's in the ovaries, but I would hate to think that someone would remove the option of children, even if someone said they doubted that they wanted to do it, without exploring the options of, for example, there's medications like tranexamic acid, which women can take only during the time of menses and substantially decreases how heavy the menstrual cycle is. And that's also, several patients do well with that medication. And I'm sure there are others and other options, certainly removal of removal of the uterine fibroids. There's some other medical options, but I think that you're right. You would not want someone to just blow you off and say, a provider to blow you off and say, well, you need to have children one day and you're here to procreate the earth. And I don't care that you're in pain. And, I just deal with it. That's awful. And there's also medications, of course, for discomfort. Of course, for many years, we've used birth control pills, not for the purpose of controlling birth if someone gives birth, but to decrease or to adjust the cycle. So some people take them continuously without having to take the placebo medication that's offered so that they don't have to have menses monthly. So that's just an example of some ways that might be addressed.
Okay, on my side, I would actually, I do agree with Dr. that we need to give them the options. rather other than them taking that if a hysterectomy is their final decision, because that pain can be managed, or like we can actually educate them on things that they can also do to suspend that pain in that a particular time. Like we have injectables which blocks the ovulation, and then when they don't menstruate, they won't be having any pain. So rather, I will suggest, or I always suggest that, okay, how about, because you don't impose what you believe, you just give them some options and they and make them make their own decisions, but give them some options. But there is injectables that will block your ovulation, and then you will take that decision at a later stage, maybe if you still feel that you need to do that. But because at this stage, you doing it for pain, but at the later stage, you don't know what you want and you have some regrets. So to avoid that, because when I'm making a decision at 12, at 25, I'm thinking differently than that time. So rather not to do something that's going to be permanent that you cannot reverse, rather go for other options. There is a family planning, there is pain management, and we take it from there. And yeah, that's what I would advise them to do.
As it pertains to women's health, only recently, like in the last few years, that were women included in a lot of clinical trials, because before it was mainly men. And for example, I was reading an article that spoke on a recent study that they did, and it showed that women actually need 10 hours of sleep as compared to men for them to actually be able to function properly. And they were just delving more into like how the test was done. But my question is, how has the historical exclusion of women in these clinical trials impacted healthcare, specifically women's healthcare in, well, now? And is there anything that's being done about it to kind of change the narrative?
Unfortunately, Black women were used for a lot of GYN studies against their will very early on. So for that reason, just not unlike the Tuskegee syphilis experiments, there's a lot of Black women that are reticent to, they're reluctant to participate in some studies. But I think more and more there are studies that are being done with women in general, especially as it pertains to women's health, because you certainly couldn't do it with men. But when it comes to certain medications, there have been many studies done since the 90s about heart disease and how with women it presents very differently than it does for men. I'm going to actually I'm going to plug in because I don't want to lose my battery life. But I do think that while it's improving, there's a lot of work yet to be done. I did want to mention the fact that before we hang up, because I would hate to do that without ending this without mentioning it, HIV screening is important, not just for people who think they may have been exposed, but and there's PrEP, which is available for people, which is prevention against HIV. For people to because people are not always as careful as they thought they would be in the moment. And that is medication to be taken the day of sexual intercourse without protection and the 2 days following. I'm bringing that up because, again, it's something that as practitioners, providers, physicians, nurse practitioners, that we often can be shy about asking people to screen for. And we ask it instead of saying, have you had an HIV test in the last year or two? To which they may reply, no, and I don't really have anything to worry about. Well, let's just get that done. Check mark, just like we check a mammogram, just like we check a colonoscopy. And so not really related exactly to what you just said, but I didn't want to lose that opportunity to mention it.
Thank you very much.
Okay.
Okay, I think Karen has another question. Oh,
So
Nurse before you go, Karen, Nurse Timbasili.
Oh, okay. On this clinical trials studies, actually don't have any comment on that. And with the 10 hours of sleep, I'm not sure if we will actually get there. But yes, some lucky people will do. And I think I'm one of those people who don't even get 8 hours sleep. So, but I try to get some naps in between. So if I get a chance, okay. And then also I would like, as a doctor has mentioned, the HIV screening, I would also like to emphasize on diabetes. Lately, I have seen some research that was done on diabetes that the girls from 21, they are actually diagnosed with a diabetes, which before we used to put it under juvenile diabetes, but now it's because of the lifestyle, the eating habits, and not being active. We're having kids that are obese and they are sitting in the lounge with the TVs and eating everything and drinking all the sugary stuff. So I think this platform, I would like to whoever will be able to get this information that we need to change the whole family lifestyle. A diet should be for everyone in the family, healthy eating habits, and we all be active, and lifestyle modification as well. Women have actually, I'm not sure about in America, but here in South Africa, we are actually encountering a lot of increase on women abusing alcohol. So, and the smoking of hubs and all those things, which is not actually a good thing for somebody who needs to invest on a future healthy life. So people will be like diagnosed on these things at their earliest stages of their life, and some gets depressed out of that. So we need to move away from a unhealthy lifestyle habits and go for screening. It's just a finger prick and you will know what is happening. Thank you.
So this question just popped as yes, Nikiwe was speaking. So there's been cases that's been happening in South Africa for the past few weeks. I read one Tuesday ago where well, actually said South Africa is one of the countries with one of the highest recorded um, rape cases, gender-based violence, sexual assault. And it's gotten to the point where it's normal to see a 14-year-old girl or like someone younger, a teenager, walk into a clinic because now she is carrying a child. Sometimes we don't know if it was intentional, sometimes it has been the situation. Um, and most families, most cultures here don't really believe in abortion. So giving up the baby is not an option unless you're giving it up for adoption when the baby is born, or the parents would raise it. So this specific news article, a girl that was 14 years old walked into a hospital because her 29-week-old twin babies gave birth prematurely, but she was shunned by the nurses and she was denied treatment. And sadly, the babies died. And when she asked the hospital for, okay, I want to bury the kids, the parents couldn't get the kids back because they cremated the babies without her permission. Now, this just brings up the topic of what should like someone young do when she goes to the clinic, because the clinic is supposed to be a safe space, but she doesn't feel safe with, in this place. She's supposed to be safe because she's constantly getting shunned, getting judged, because one, she's so young, and how could you have gotten to that condition? Why are you having kids? Shouldn't you be focusing at school? Again, we don't know what the backstory is, but how should one go about if they can't get the care they need in their environment, in their community, because she's being shunned for dealing with such a situation?
Okay, on that, it's a very sad a part because when they go to that public clinic or hospital, sometimes it's because they don't have funds to go to the private clinics or so. And with the private clinic, I'm not talking just because I've got my own practice. That's where they get all the attention that they need. And that's where they don't get judged. And that's where they will actually be able to make decisions and you help them. And in a way, the reason I'm saying that is, okay, just to cut a story short, I had like clients who will come, it's a teenager, he wants to do an HIV test. And when you are counseling and you say, okay, if it happens that the results are positive, do we have a support structure? Is there anyone that you can actually share this with? Because it's not something that you can keep to yourself. You need to share it with someone. And they will just say, it's you, sister. So that tells you that they feel comfortable getting or talking to you. They develop that trust within that space. So I think we need, South Africa needs to actually emphasize the care.
Our rapid fire questions for both our speakers. Who do you admire and why?
All right. To me, unfortunately, it's not somebody that is a celebrity or so, but I've got a colleague that is actually been taking me every step of the way. When I started business entrepreneurship, he's been my mentor. It is a Yeko. Unfortunately, he's not on the limelight, but he's one of the people that I really admire because anytime you look for help, he will like give herself all the time and he will just walk with you every all the step of the way. I am now gaining my confidence because of the lady. It's Trinile Yeko. She's also a nursing sister.
Who do I admire? So I'm going to probably give you an answer that you may have expected and a lot of people say, but I find Michelle Obama to be fascinating. And I admire her tremendously. While she's not in the healthcare space, and that is not even important, what she did with regard to obesity and the impact she made, which I feel is pretty significant, and just telling people to move, I think is amazing. It inspired me to get into lifestyle medicine, which is what I do now. I do a lot of weight management with my patients. I do have a lot of weight management conversations with people in general. And it starts off with me asking people what their relationship is with food, because it starts very early on. And just how we are around the dinner table, when you sit down for supper, when you are you talking over food, or is everybody just eating in front of the TV or devices or on social media? Are you going back for seconds? How big are the portions to begin with? How many times a day have you eaten? Is it 3 times, or did you save it all into the big meal because you pushed yourself throughout the whole day, which we know slows down your metabolism. So that's just an example of someone who impacted me and why.
All right. And then your favorite quote from a historical figure that guides you in terms of your career.
Said, I think I'm going to be like repeating myself, but okay, I have a colleagues that I like was looking up to, and one of them was like my tutor. And when I was doing a registered nursing course, it's one person that was Mr. Fleming, who was like believing in me even when I didn't like have confidence in myself. And he will see something that I was actually not even able to see. So it was Mr. Fleming, and he is the one who actually drive me to actually pursue this career and even go to specialty, because now I developed the thing of, yes, I can do it. So with him next to me, I was able to pursue my career. And that's the reason why I'm here today, talking as a nurse-preneur as well as a occupational health consultant. Thank you.
While Harriet Tubman helped thousands of enslaved people to escape freedom in the Underground Railroad, she actually served as a nurse. So she cared for people who had medical concerns and issues. And while I'm not a nurse, I'm a physician. I always go back to the fact that why I got into what I'm doing is to help people, to heal people. And we know that healing is more than just physical. So I imagine Harriet Tubman in ushering people into their freedom also ushered them into health, good health. And I think that that's a beautiful thought. So that's an inspiration for me.
Okay, last question for the both of you. What's one piece of advice that you wish your younger self had that you only learned later on in life?
For me, I think it would be something that my mother used to tell me, and she's not with me anymore, but I hear it often in my mind, and it's actually in the Bible, but you have not because you ask not. And so often, I think as women, we take no for an answer. And I think when I was much younger, I did that. And I learned as I became more confident, as I've aged, certainly into being a teenager and high school and college. And with every year, I become more confident and know that sometimes the no is God giving you the no. And I've started to recognize the difference between that and when man is telling you no. And so that has been something that almost motivates me if I know that God has it for me and you're trying to keep it from me. So that's what I would say.
Over to you.
Okay, with me, I'm not sure if I understood the question. I think I will say self-confidence. I wish I knew it when I was younger. I think, oh, I was going to be far from what I am today. But I think I didn't have that in me. And people used to see what I had, but I didn't see it in myself. But I wish I've believed in myself at the earliest stages of my life.
I'm going to hand over to Miss Tina. Thank you so much to both of our speakers. It has been truly incredible. Miss Tina, over to you.
Thank you so much. I tell you, what a fruitful conversation. Effie, I want to thank you for moderating the session. And to Dr. Elizabeth Nelson, as a dear friend of mine, thank you for at the last moment saying yes and being a part of this conversation. And Nurse Nikiwe, for offering your voice as well as the path in which you are leading in South Africa. And it can be a bit tricky leaving the medical space and starting your own business, but definitely being an advocate. And that's what this conversation was about. For Women's History Month, I want to make sure that we're always bringing leading women around the world, whether it's in the tech space or in the healthcare space. And it's even more important now and vital to make sure from a healthcare perspective, it doesn't matter how much money that you can make. If your health is not intact, that truly is your wealth. And so I want to thank you all for tuning in. Again, this is going to be aired live on the 29th. And something that I haven't said before, but I feel compelled to say it now. When you tune in to look at this, make sure that you're bringing 2 or 3 other people with you so that you can hear the conversations. You can start putting together a journal and notes, questions, have those family conversations. More importantly, make sure that you're advocating for yourself when you're going into that doctor's office or that nurse office. You are the CEO of your body. So I thank you all for tuning in. And our next masterclass series that's going to be in April is going to be also with another dear friend of mine. His name is Dennis Spooner. So make sure that you tune in. That's going to be on April 12th. And Dennis is also from the healthcare field, but we're going to take a slightly different angle. Because April is Financial Literacy Month, he's going to walk you through how he and his wife created a fintech health business and how he exited, some of the lessons that he learned along the way. And it's not just the technology, but they also sold a healthcare business. So he's going to walk you in and out. So all of the entrepreneurs that's out there that's in the tech space or in the healthcare space or, you know, across the spectrum, if you want to get on the basics 101, how do you handle yourself? And Dennis is also an attorney as well. So from a legal standpoint to being a fintech, I would say leader to exiting, and now he's a staunch investor. And he wants to help. And he's going to also be with me on the continent and looking at other entrepreneurs in which we can invest in so that they can have the future. Make sure that you tune in on April 12th. Again, I want to thank you all for tuning in to this. And again, health is your wealth. Make sure that you're advocating for yourself as well as others who can. Take care and have a great day.